Hello, my name is Claudia Gillum and I'm a sophomore at Alabama State University. In this video, you can find my interview with Miss Madison Ferguson about physical therapy at Alabama State, and I hope you enjoy this video. At the end, I have left my contact information if you have any questions for me or Miss Madison or just any questions about the video in general. Hello, my name is Claudia Gillum, and today I'm going to be interviewing Miss Madison Ferguson. She is the head physical therapist here for Rehab Associates at Alabama State, and I'm just going to be asking her a few questions today about herself and about physical therapy here at ASU. So first, tell me a little bit about yourself.
Hey, so I am a physical therapist and athletic trainer. Like Dita said, I'm employed through Rehab Associates on campus at ASU. I graduated from Alabama State University in 2023 with a doctorate of physical therapy. And I graduated from the University of Alabama in 2020 with a degree in athletic training. I work here on campus at ASU for the baseball team as the baseball athletic trainer, as well as the physical therapist overseeing the clinic.
And what's your favorite thing about being a physical therapist?
My favorite thing about being a physical therapist is being able to watch my patients get better, get back on the field, and playing the sports that they love.
What's the worst injury that you've ever seen so far?
The worst injury that I've seen so far is probably a total knee dislocation. That one is really hard to come back from. It's a really rare injury, and the progression back to sport is very interesting and is still to be determined.
And so, how do you think athletes handle the mental and physical challenges when returning to play and progression to coming back to sport?
I think with every sport there is a mental component in overcoming the adversity of your mind and also the physical adversity of the healing in your body. I think that each person is different, just like each injury is going to be different, and so the way that we choose to manage the plan of care in their physical return to play is going to be the same way in their mental return to play. It's going to be very patient specific. It's going to be dependent on how that person responds to stress, how they handle adversity in other areas of their life, and based off of those things will kind of determine how we progress. So whether that's through some sports counseling, some mental training, whatever we have to do to get them back to their level of function, we're going to do that mentally and physically.
What sport do you think you see the most injuries in?
I think that is a really hard question because I think in every sport there are different levels of injuries. I think that as far as contact sports go, the most acute injury would be football. But then you have sports like track that are very chronic. You have sports like baseball, which are very chronic but can also be acute. And then you have sports like soccer, which could also be acute or chronic, just kind of depending on the mechanism of injury. But based on the most instantaneous traumatic injuries, I would say football at this school.
And lastly, what advice would you give to someone aspiring to be a physical therapist?
My best advice that I could give to someone that is aspiring to be a physical therapist would be to never stop learning, to always push yourself to grow a little more in your knowledge in whatever field of physical therapy that you're interested in. Physical therapy is not just a run-of-the-mill degree and career anymore. There's so many avenues that you can go in as far as sports, home health, inpatient care, neuro, women's health. I think that with anyone that is interested in physical therapy, you should do your research, see what you're interested in, but also learn from anyone and everyone that you can.
Those are all the questions I have for you. Thank you so much for your time. Thank you.